the post-traumatic stress disorder in veterans is again very high, and that issue, unfortunate numbers, 17 veterans who are committing suicide every day, and there is a big area of veterans where we can help with these techniques and with these digital platforms.
It's Tony Zan here. I'm founder of Sbur Decision Lab. We feature entrepreneurs, their stories, and decision making to help you make smarter decisions and achieve success. Enjoy this episode.
I'm Prameet Makude. Prameet means friend of all, easy to remember. I'm here in Massachusetts. I'm a co-founder of Relax Infinity. It's a digital mental health wellness platform to take care of your sleep issues, your anxiety issues. So basically sleep better, feel better, anxiety, depression, then think better. It helps you with building your memory, focus, and live better with weight management and nutrition plan.
So, can you share with us the origin story of this innovation technology that you're building?
I'm originally from India. My co-founder, Dr. Krishna Bhatt, is from Harvard MGH and then FRCS London, but he also has deep roots and deep understanding of Indian ancient wisdom of yoga, meditation, breathing exercises, mindfulness. So what we are trying to bring is, we are trying to bring the best of the East and the best of the West together. The time-tested mechanism of yoga and meditation and breathing exercises coming from India, how to match it with the modern science and make it useful for America and to the whole world, and particularly how to handle the mental health crisis that we all are facing right now. The personal story is, there are many stories, but one of them is when I went to UMass Amherst, where my daughter was studying, I saw so many kids are on antidepressant or some kind of prescription drugs for mental issues, which is very, very surprising or alarming. The numbers are so high, but definitely you can get a lot of benefits if you start using these techniques first before going to the prescription medicine. Same thing for elderly people. I have some good association with the elderly daycare center. Even at my home, when I seen my dad having sleep issues, the doctor immediately prescribed him with 2 additional pills, which was not required. When he started doing this chakra meditation and sleep meditation, it started helping him and trying to reduce him from the medication. So there are multiple stories like this where you can definitely help people from across the different verticals of the society to first to take care of with these methods, and they are very effective, and then you, if required, go to the prescription drugs.
I saw good tractions you have already made in terms of getting users onto the platform, the paying customers. And also sounds like you got a lot of potentials in the marketplace for this product. How do you decide which market that you want to go after first and foremost?
I think the student community is one area where we would like to go, and there are 3 areas where we would like to focus first. One is the student community, and second is the Indian American community, because there is a vast Indian American community, 6.2 million Indian Americans in America. Per capita income is also very high, and they are more adaptive to this yoga, meditation, and because of the cultural sensitivities and the cultural connection that they have with these techniques. So that is the first target audience, and then we are going to expand it to the other places. And second, the veterans, the post-traumatic stress disorder in veterans is again very high, and that issue, unfortunate numbers, there are 17 veterans who are committing suicide every day, and there is a big area of veterans where we can help with these techniques and with these digital platforms.
Wonderful. Thank you so much for sharing your insights with us.
Thank you. Good afternoon. It's Prameet Makude. Couple of years back, I went to my daughter's college at UMass Amherst. I have seen that there were many kids were on prescription drugs for anxiety and depression. I was surprised when I asked her. She said it's not unusual. 1 in 10 kids or more are on that kind of drug. Then I have a 72-year-old dad. He was having some sleep issues. Immediately, the doctor prescribed 2 more medicine to his list, and that's where we gave my dad and my daughter a couple of meditation techniques and all that. It started helping a lot. So that's where we thought that we need to bring the ancient wisdom coming from India and some from China, like best of the East to the best of the West together. And that's why we developed this app, which is a digital mental health and wellness platform. We know that millions of people facing stress, burnout, loneliness, sleep issues, and many of the issues related to mental health. And that's why, as I said, we have these 4 simple pillars: sleep better, how to sleep fast, how to sleep deep, and how to do a conscious sleeping. Then on the better, stress, anxiety, depression. think better, memory, focus, clarity of mind, and then weight management and nutrition. So it is one digital platform, but provides you so many solutions, and it has been tested with 10,000 downloads, so many positive user feedback. Three enterprise clients, one a bank, one hospital, and one construction company from Maine. We are now want to expand it further, but more importantly, now we are building the AI guided solution. That is when you can be asked that, hey, I'm a 22-year-old student, I just had a breakup 2 weeks ago, I'm feeling very depressed, what to do? It will give you a routine and a pathway on how to cope up and how to handle the situation. You can even ask that, hey, I'm a 60-year-old, my mom passed away, what to do? And it will give you a guided meditation and a whole pathway how to handle that situation. That needs to be still further built. We have started building on it. Wearable integration is another solution that we are working on. The 17.5 billion mental health app market is now. We are a very affordable solution. It is 599 per month, but $49 per year. And for more than 500 users for enterprise client, it's at $1,250 per month. Right now, we are targeting 6.2 million Indian Americans because they are more attuned to this meditation techniques and culturally attuned. But we are going to expand it to many others in the whole of America as a market. Students, seniors, employers, university, hospitals, and veterans for post-traumatic stress disorder. There is another pilot we are working with some MIT folks here. And we are actively talking with Persistent Software, Bola Petroleum, and few others. Krishna Bhatta, he is from Harvard MGH, FRCS London. He is a functional expert in psychology as well as he has deep clinical experience. I have a good experience in technology and with fundraising and partnerships. Chinmay travels between India and America quite a lot. He's a CTO. And Richard Fletcher, he is working very actively with us, and he's done a lot of pilots at MIT. He works at IT. Yeah, we are asking for 750,000 with 20% equity offered. Post money valuation is 3.75, and we are on a very conservative side. We are saying that valuation will be easily hitting in 36 months 20 million with 5x return. Thank you.
Now you have heard the story and the investor pitch. Where are you on your startup journey? What decisions are you wrestling with? Comment below or take a quick survey and we'll let you know right away how investor ready you are.